All right. Well, hello, everyone. Hopefully, you guys can hear me and that I sound okay. We should be getting Matt in here soon. Alex should be well on his way. I guess I'm here to fill some dead air. Can you guys throw up some emojis maybe in here real quick, just to let me know if you can hear me okay? Hoping everything sounds good. Okay. Danielle gave me a peace sign, so hopefully that means I sound good. Addie, thank you. Matt, cool, awesome. All right. Oh, there's Alex. We'll get him in here to speak.
I'm here.
Ooh, you're here. Welcome to here.
I don't know if I was the him you were referring to.
But... Yes, you in fact are the him. Not like the band him, but like you him.
Just me.
Just you. All right.
While we wait for Dr. Rodu to join us, I was actually checking to make sure that I didn't get any last minute emails saying I don't know how to do this, help. So we're just waiting for Dr. Rodu to join us in the space. And I'll start everything off by introducing CASAA for those who are not familiar with what we do or who we are. CASAA is the Consumer Advocates for Smoke-Free Alternatives Association, the oldest and largest consumer grassroots THR advocacy organization in the United States and possibly around the world. And for those of you who are new, go visit our website, casaa.org. Tons of resources, opportunities to get engaged with lawmakers, keep up on all of this policy nonsense that I'm sure we will dip into tonight. And I see that Brad has joined us. Brad, all you need to do is request to be a speaker. There's a little microphone looking thing at the bottom. Just tap on that and Danielle will give you speaker privileges.
Oh, and just so Danielle doesn't yell at me, also, while you're over at CASAA.org, you should check out some super sweet merch, because Danielle made some pretty cool t-shirts and other things. There you go, Danielle.
Thanks.
Thanks very much for that.
You're very welcome.
I needed these.
Dr. Brad, I have sent you an invite a couple times, so if you also just want to click accept, hopefully that's popping up there, but I've sent it over.
So even though I expect maybe the timing will be a little off here, I will go ahead and introduce Dr. Rodu. For those of you who do not know Brad Rodu, he's a professor of medicine at the University of Louisville in Kentucky, a senior scientist at its James Graham Brown Cancer Center. And I must confess, I was looking for a short and sweet introduction, and so I went to Tobacco Tactics to get this very brief description. Dr. Rodu has a background in dentistry and oral pathology, which of course led to his ultimately research on oral tobacco products. And if I remember correctly from listening to you speak in the past, noticing some inconsistencies between what was actually showing up in the data, the epidemiology, versus the fear and panic campaigns that I think we were all exposed to. I don't know if it was starting in the 80s. I'm certainly a child of the 80s and have maintained a poor opinion of oral tobacco well into my young adult life. All the while, of course, continuing to smoke cigarettes. And one of the more interesting projects that Dr. Rodu was spearheaded or was part of. You'll have to correct me if I'm misrepresenting your role in this, but it was the Switch and Quit Owensboro campaign. This is from more than a decade ago, but it was essentially a public health campaign to help people transition away from smoking and choose smoke-free tobacco products instead. And as we have noted many times on our media, on our our page, in our materials. Smokeless tobacco is demonstrably less harmful than smoking cigarettes, orders of magnitude. In fact, the early estimates about how much less harmful vapor products would be were really based on data from snus, a oral tobacco product from Sweden. And I see we have a lot of familiar faces here, so I'm sure I'm just running over stuff that you guys already know. And we're still waiting for to get Brad connected as a speaker. And
Yeah, I'm not sure. Dr. Rodu might be having some issues on his end. We've sent over some DMs and things like this, no responses yet. So not sure if you can hear us, Brad, but yeah, either the microphone down at the bottom left of this Twitter space, you can click that to request. I'm not sure exactly where requests from the space themselves show up, but there should be that somewhere as well.
Yeah, Danielle should get a request when it pops up. Oh, you're talking about our invites.
Yeah, when we send them out, I'm not exactly sure where like a host invite, like that kind of invite shows up, but that should be somewhere on the screen as well.
Well, we seem to be adding some more people, so that's good. We're filling time here so that we can let more people join. That'll be the ticket.
That'll be the ticket. You mentioned you mentioned that it wasn't until your young adult life that you started learning more about oral tobacco. I was very much in the misinformed camp until maybe 2018, early 2019, whenever I had sat down and actually had Kristen on my old podcast, and you was when I started learning more about oral tobacco and the decades of misinformation about it. And then obviously from there I dug into CASAA's site and did a lot more research, including research from Dr. Rodu.
Yeah, I think I don't know. I might have shared, when we talked on your show, and I've shared a couple of times. The first time I tried snus was in 2008. Of course, ultimately, this conversation tonight is not just about smokeless, but we're going to take advantage of having Dr. Rodu on when we can get any of the technical issues worked out. But 2008, I was looking for a smoke-free option that I could use on public transportation for my job. And Camel Snus was being sold. It was it looked like a new product. It was a new product at the time. And I had to confront that misinformation that I had been force fed as a teenager, and decided to look into it. And Carl Phillips, I think, was one of the first people I read about the relative risk of snus versus continuing to smoke, and of course smokeless tobacco generally. So yeah, that was 2008, and like a lot of people, we talk about this all the time with the propaganda that we see on against vaping and so on. The same moral panic was applied to smokeless tobacco, and we talk a lot about, in the vaping community, people talk a lot about harm reduction, but it seems that we have a lot of folks still very skeptical of smokeless tobacco. I imagine, I sort of hope that nicotine pouches act as a bridge to helping people understand better what smokeless and smoke-free nicotine, oral nicotine products are all about, and what the risks are, of course, compared to smoking. So yeah, I'm starting to trip over my tongue here.
Yeah, it sounds like we're just still trying to. Danielle is in discussion with Dr. Rodu. He is with us. It seems maybe like a microphone issue or just a connection issue right now. So he can hear us, and he's here. We just haven't been able to quite get him connected. connect it to everything.
Yeah, we're just having a settings issue. You know how phones go with giving apps access to microphones. So we're trying to work through that.
Ooh,
Hi,
it looks
everyone.
like
I think I'm finally here.
You are
you
fantastic.
are. Welcome.
Thank you very much. And I apologize. This is the first time on Twitter, and I had to set up the microphone and was confused by that. So I am here and ready to go.
No worries. I hope I hope my introduction and brief background that I read from Tobacco Tactics would suffice for bringing you in tonight. If it doesn't, then I'll just blame it on Logan. But
Tobacco Tactics made me
That's
smile, that's for sure. So
it's perfectly fine. I accept the blame either way.
Awesome. Well, welcome. As I mentioned in getting you ready for the show, we wanted to talk about the National Youth Tobacco Survey data that was recently released. And I noticed I didn't recommend your blog yet, but if you are interested in some visual aids to go along with this, you can always go to Dr. Rodu's blog spot. It's rodutobaccotruth.blogspot.com. And he has 2 blog posts up about this. And with that, Dr. Rodu, take it away. Tell us what you've come up with in the National Youth Tobacco Survey data.
well, this is following a very similar pattern to many years now. So what happens is that this is a CDC survey, and they get the data and they analyze it, and then they put out a report months to perhaps a year after after the survey has been conducted nationwide, and of course they spin it to their to their narrative. And then nobody else has the data to analyze the survey for anywhere from 6 months to up to a year. And this has been standard with almost every instrument that the federal government has. And they just released the data 2 weeks ago, and I started analyzing it. And one thing that the CDC never does as a matter of policy is combine tobacco use in their prevalence statistics. In other words, they show cigarette smoking among high school students as one bar, and e-cigarettes is another bar, cigars, smokeless. They're all separate columns on a chart, but you have no idea how those different behaviors are interacting. And that's what I'm able to do when I finally get the data. I'm able to show that a reasonable proportion of e-cigarette users are also current smokers. And I'm able to draw some other insights from the data that the CDC is just unwilling to talk about. And I've been critical of this for many years now. I've been tracking this data probably for 6 or 8 years. Each year, I analyze the data and add to my chart that shows this in perspective. It gives you some sense of what this data means, not just what the CDC wants you to know, to believe it means.
Yeah, and that's frustrating for a lot of reasons, and I think one in particular being when the CDC puts out that report and tells the world how many of our youth are using e-cigarettes or whatever in a given time in the U.S. We can't we're not getting that data for like you said, 6 months, a year down the road, whatever their narrative is that goes out is picked up by mainstream media, is blasted all over the internet, yada yada, campaign for tobacco-free kids, and etc. Take it and use it. But we don't have the data to necessarily and accurately counter that argument for, like you said, upwards of a year.
That's exactly right. For example, they put out these numbers, both millions of students, and they do put out some percentages or prevalence rates. But they don't, number one, they don't put out the perspective that these kids are also using other tobacco products or have been exposed to other tobacco products. So they have ever used other products. This is very important because they're not quote unquote virgins, as I term them in my blogs. They are experienced tobacco users. So, but that doesn't serve this narrative that this is a brand new and separate epidemic of tobacco. That it doesn't serve that. And so the CDC never talks about it. Secondly, up until this year, they never talked about which of these vapors, and I do specify which vapors are quote unquote virgins. The next thing that the CDC never asks is how many of them are below 18 years of age or 18 plus. Now, until very recently, as you all know, that the underage is what was of concern, but the 18 plus vapors were not only legal, but they were likely the predominant source of all the vaping products to the underage kids. It wasn't the manufacturers or the retailers that's supplying kids. It was legal age kids, teens and young adults, who were bringing those products in and sharing them with underage vapors. So we never heard about that either. And these are very, very important. And then we finally didn't understand that the underage virgin vapors were a very small proportion of all high school students. This year in 2021, they were about 3% of all high school students. Now, no one here or anywhere should be comfortable or accept that there should be any high school vapors. But it is a far smaller proportion than we are being led to believe by federal officials. So that's my main point.
Yeah, one of the things I saw, first of all, that when you putting this into context that CDC is so sorely lacking in their presentation, it's this very clear downtrend. I mean, even if we're looking back as far as 2012, combining all of the smoking, dual use, and vaping together is down from 10 years ago or 9 years ago, the data going according to the data.
Absolutely. And first of all, the most important downward trend is the dark blue bars at the bottom of my charts that show the smoking only rate. Those are down to trivial rates. And even the combined rates, the dual use rates. You combine the dual use and the smoking, you get all of smoking. And those have been plummeting even when vaping was going up in 2018 and 2019. Those smoking rates were coming down. And now the vaping rates are coming down and the smoking rates continue to decline. So these are definitely valuable insights that we're not getting from federal officials when they release these numbers.
And it's also, I know that, I mean, sort of the data that's come out from 2020 and 2021 is sort of couched in this whole, oh, well, it's a pandemic, everything, everybody's behaving differently. We were all in lockdowns, the economy shut down. So it's this, the narrative is, of course, we can't use this data to compare to previous years. And you get into this on one of your recent blog posts about, kids staying home, comparing the, smoking and vaping at home versus kids who were in school in 2021. And the joke is funny that, well, I'm not going to spoil it for people. Go read the blog post.
Yeah. You can read it on the
um,
blog, but yes, it's true that kids who stayed home smoked and vaped less in 2021 than the kids who were at school when they took the survey. That makes sense in a way. At home, they're a little bit more, they're not as free to do these extracurricular activities. But the other important point I make, and I'll leave the joke, you can go look, but the other important point I make is that even looking at the school rate in 2021, just look at the school rate, which should be comparable to the school rates from earlier years. We still see smoking down. We still see vaping down. So I think it's very good news, regardless of how you look at it. Take all the at-home kids out, you still see declining rates of both. So, I think this is positive news, and we know it's positive. We can rest assured it's positive because the CDC and FDA aren't talking about it. That's how we know for sure.
Yeah.
It is surprising that they're not at least, propping up the smoking rate numbers as a victory because of all the work they've done for decades. I don't know if maybe they don't want to prop up the low smoking rate because they're maybe afraid of a small rebound in 2022 numbers, or if it doesn't fit into their whole, vaping as a gateway to smoking narrative or what. But you would think like with that, because what was it, like 1.75% or something? Like it was something crazy low.
It is crazy low. And, not only, we can talk all day about, well, is NYTS reliable with the new surveys, number one, they went from paper surveys about 2 or 3 years ago to computer surveys. And that was a big change. This last year, of course, 2021, we had the COVID issue. But also keep in mind this. In young adults, age 18 to 24, okay, the National Health Interview Survey, another CDC instrument, is also recording declining and record low smoking rates among 18 to 24-year-olds, young adults. So what we're seeing in high school is continuing. It used to be 15 or 20 years ago, we saw the highest rates in young adults. And it made sense. Kids got out of high school, no parental control. They're in college, they're working, they're in an apartment, and they're experimenting. So they had high smoking rates and all other rates at that time. Now, 18 to 24-year-olds, they may be vaping, but they're certainly not smoking, just like their teen counterparts a few years younger. Well, that is fabulous news, because that means ultimately when they become older adults, they're not going to be carrying all of that smoking baggage for risks from all these different diseases. So it's all great news, and we're not hearing a word of it from federal officials.
One of the questions I had about the school versus the kids who were at home during the pandemic was, and you talked a lot about essentially access. Kids that stayed home didn't have access to the older kids who they could get the e-cigs off of. And I understand that's certainly a significant part of the equation, but I'm also curious, with kids being, having to stay home. I was about to say being able to stay home, but having to stay home. There's a certain amount of comfort and security that comes with being in your own home. Certainly not all kids have that. And I imagine there were a lot of stresses the parents are going through that may make a household a bit more unstable given the circumstances. But I'm wondering if that also has a role to play, and if there is any instrument out there that could confirm or investigate that essentially the lack of stress and anxiety of going to school or being in that school and social environment and so on played a role.
It's interesting, and I'll be blogging on this next week. The NYTS also asks kids the reasons that they have vaped. And I look at the last 4 years during the time when vaping spiked up and then back down. I look at the kids' responses, the vapors, the high school vapors' responses to those questions. And I think you'll find that very interesting too. Like I said, I'll put that blog out early next week. What's interesting is they've changed the questions over time. Now that drives an analyst like me nuts, because you don't like to see those changes. That introduces problems. But in 2021, they did ask kids if one of the reasons, and it was a new reason in 2021, whether they vaped because they were, I think it was stressed, anxious, stressed, or depressed. And they got a big response for that particular item. So, but we don't have any other years where they've collected that information. So we really can't put it in too much perspective.
Yeah, I know that's been kind of a problem throughout this. I remember these conversations and changing questions year after year. It's hard to make comparisons. And, one of the things that comes to mind was, I can't remember, it might have been e-cigarette summit in DC, but there was some talk of the need for more kind of rapid response in terms of making policy changes and everything that comes along with making a rapid response. But we need survey instruments that are administered and analyzed more frequently. I mean, does this? I can only imagine this flip-flopping in questions, especially questions that were once on. I think there was a question about cannabis that was on 1 year and then it wasn't included the next. I mean, doesn't that sort of needlessly complicate things? And I mean, is that a barrier to having more effective surveys and more useful data in a timely manner?
No, I totally agree with you. Canada, marijuana vaping was on the survey in 18, off in 19, back in 20 and 21. And it's totally inexplicable why they did that, how they dropped that very important question. And again, they don't talk about marijuana at all when they release the vaping statistics. And I think that's very disappointing, because number one, many of these kids who say they're vaping may be vaping marijuana and not nicotine. We have no idea. This survey does not distinguish. But we know that a lot of the kids, if you vape frequently, you're very likely to be also vaping marijuana. But it's that a majority is present in all frequencies of vaping. I looked at it in that blog post. I looked at 1 to 9 days, 10 to 19, and 20 plus days. the latter being, of course, frequent vaping. There was a majority in all categories that were vaping marijuana. So, yeah, we don't know what that means because we can't sort it out. And then additionally, that plays into this whole disaster with EVALI, where the CDC was very, very slow to even acknowledge that these illegal THC products were being implicated. They continued to put out the veil that it was e-cigarettes and nicotine vape products, and that's just that was criminal as far as I'm concerned.
Yeah, and it continues to plague us in city councils and state legislature committees. People, and it's really, it's well-meaning. It's young people. Embarrassingly, sometimes it's health officials, and of course the body parts lobbyists, but are very frequent in citing lung injuries as a reason to pass some horrible policy. And speaking of cannabis, you as well, and several people noticed the weird numbers around heat not burn. Without me reading things, what was your analysis on the heat not burn numbers that kids are reporting?
Well, they're reporting prevalence rates and actual numbers that are far beyond what was possible during that year in 2021. Because number one, as everybody here knows, I'm preaching to the choir, HNB products were only marketed in a couple cities in this country, and the uptake was debatable. I mean, I don't know how many hundreds of thousands. I doubt that it even reached the millions of actual smokers who made the switch. So now we have several 100,000 kids who claim that they, in the past 30 days, had used one of these products. I mean, that's just impossible. When I was at a meeting in Canada, and it wasn't a tobacco meeting, when I was at a meeting in Vancouver a few years ago, I decided to my wife and I walked over to a IQOS store and tried to get in. And I'll be darned, I couldn't get in. And I gave them my credentials as a tobacco researcher. They would not let me in those stores. And I think that's very firm policy throughout the world for PMI and IQOS. You have to basically swear on a Bible that you're a smoker in order to get in there. And they are not going to let kids in. And so this is just impossible. So either kids are confused, they've confused HNB with vapor products because they heat them, that heats up a liquid too. Or they're just simply filling out these surveys and kind of just, hey, HNB, that's a new product I haven't heard of. Shoot, yeah, I'll say I tried it, or I'll say I'm using it. I think there's a lot of that in any teen survey that we have to be careful about.
Did they say heat not burn, or did they mention specific products? I forget. Like, did they say IQOS, or did they just say heat not burn products?
They mentioned both. I actually looked into this. They list IQOS, Glow, and Eclipse. Dr. Brad,
Okay.
I've actually done a little bit of research on this, and I have a theory that is potential, and perhaps not all. I agree with you that there's probably kids that just fill this out and say, oh yeah, I tried it, and they're not even, paying any attention. But so they list, like I said, IQOS, Glow, and Eclipse. And I actually went down a rabbit hole of trying to figure out if and when any of these products were even marketed or available in the United States. And the interesting thing is that both Glow and Eclipse are also the name of heat not burn cannabis products. Eclipse in particular because heat not burn has been around in the cannabis industry for very long time. That's a pretty normal thing. And
Yeah, that's what I was wondering, if that's what they're getting confused by.
yeah, there's no less than 4 vaporizers called Eclipse. Some of them even, I'm sure to skirt the legality of cannabis, put on the bottom of their website, oh, this is only for tobacco products, because they're basically trying to stay legal. But
Very
I think,
dry or
yeah,
vacuum. Yeah.
I think that's something that could potentially be going on.
Fascinating information, and I'm going to look into that. Thank you very
Yep.
much.
Dry air vaporizers for cannabis are a lot more popular, and there's a lot more of them out there than for tobacco.
Yes. Yes.
Yeah, I was going to say, in Eclipse, I mean, Dr. Rodu, you might remember this. That is actually, well, that's the product that Reynolds got through the substantial equivalency pathway. But what it is, for people who don't know or didn't have the weird privilege of using one, it is a cigarette. It's got paper and a filter and everything, but it has a carbon tip, and you heat it up with a lighter, and that, of course, draws, as you draw on the cigarette, it draws the super, or the very hot air over the tobacco leaf and vaporizes the nicotine, and there's no combustion. You're left with this large disposable paper and whatever plastic and foil cigarette thing, and it tasted like dog farts. I don't know what dog farts taste like. I'm just using that, so don't try to be cute. But it was
Gonna
only
chime in.
marketed.
I'm not gonna.
Yeah, just hold your tongue, man. I know you're working on something. But no, it was only marketed in 2 cities in the 90s, and I happened to be in one of them, Chattanooga, Tennessee, and had a housemate at the time that was obsessed with them. But man, they were a mess, and they were disgusting, and I don't think they're sold anymore. And so it's another one of those things. Like, why even ask if kids are using this product that, as far as I know, isn't actually sold in the United States?
I think that Reynolds may still have a couple stores around Winston-Salem that may sell a few packs of them now and again. They may still technically be on the market. I'll tell you a quick story about those products. They came out somewhere around 2000 or late 90s, early 2000s, and they had a big promotion, and the Reynolds folks offered for anyone in the U.S. at an academic institution that was interested in these products that had some lower risk profiles, from a standpoint of the components, they could call Reynolds and they would send one of their experts to discuss them. And I called, and they sent their top toxicology researcher, and he gave a talk at the UAB School of Public Health, sponsored by me at the time. And in private discussions with him, he told me that I was the only academic in the entire United States who was interested in that, in finding out more information about that product. But it was a successful visit. We got a good look at these products. And sure, there were downsides to them, but it was a fascinating introduction to a heat not burn tobacco product.
That is surprising. I expect a low turnout, but for you to be the only person curious about that is actually shocking to me. And I don't know if you wanted to get into this. I mean, of course, the topic was NYTS, but I feel like, I mean, unless there's more to drill down on here, we've kind of.
I do have one thing that's kind of eating away at my brain here. We were discussing access, and I'm curious about, your thoughts, Dr. Rodu, on T21's effect on this. You had brought up seniors in high school, and they weren't really asking necessarily about over and under 18. And, at the time when 18-year-olds could legally purchase tobacco products, if T21, if in part that decline that we're seeing across the board, how much of that do you think is T21 and these seniors, these 18-year-olds now no longer being the vape and cigarette dealers of high school? How much do you think that plays a part, or do you think a lot of that is more of the isolation, the pandemic, and et cetera?
That's a great question, and I don't have a specific answer. I will say, as background, that I became an advocate for T21 and made a couple and have a couple blog posts a few years ago when I changed my mind and endorsed that concept. And the reason I did is that I believed that it would take out an important conduit for the underage users of any tobacco product. And so, but I don't have any evidence, and I've been looking for it in other youth behavioral surveys, NYTS. We really don't yet have conclusive evidence that T21 has had a measurable effect. Every time you measure an effect like that, you have to take into account that the trend was already going down. And I get a kick out of groups like Campaign for Tobacco-Free Kids and Truth Initiative, where they take credit for things that are already on the decline. They say their particular actions caused these things when they were happening anyway. So I'm always very conservative in attributing these kinds of changes to any one particular entity because, in reality, it's all complicated. But I will be continuing to look at that. That's a great question.
Yeah, I'm sure folks have noticed recently, I guess within the past week or so, we've been seeing statements out of the campaign, and I assume the body parts groups are close behind. The kids are having a really hard time quitting vaping, which is interesting to me because it wasn't that long ago that Truth Initiative was touting the success of their Nag You Till You Quit vaping app. And so and of course, I think most of us can do our own math on this and realize that it is just more bullshit coming from the body parts groups. But, I'm really interested to hear, I know that we've seen a study recently about, I don't want to say addiction liability, but I guess it's better than abuse liability, that young people are actually experiencing a lower addiction liability with vapor products, and I assume other smoke-free products. There's looking at that in vaping. I've always been kind of curious as well about that kind of profile with smokeless products.
Well, absolutely, and we've looked at it with smokeless products. We actually, my group, in conjunction with Carl Fagerstrom, who is one of the premier nicotine scientists from Sweden, we published an article a few years ago about the relative dependence scale of smokeless tobacco users as they report it, compared with the how smokers report it. And we believe that smokeless tobacco represented a lower dependence level than smoking did. And, I know I've blogged on that too. You can put Fagerstrom in the search function of my blog. You'll come up with that report. I'm not an expert on dependence in vaping, and we're looking a little bit at that, but I'm not at this point going to make any specific claims about vaping as opposed to smoking. But one thing I will say, I mean, we'll make one comment about these organizations and their claims is, on one hand, they say that nicotine is a lifetime addiction. And on the other hand, they give all these trivial tips for quitting that make it like anybody can quit. Like if you want to smoke, eat a carrot instead, or do these kinds of things. They never have it consistent. They want it both ways. It's either a lifetime addiction that nobody can break, and if that's the case, we got to have tobacco harm reduction products. But then they say anybody can quit using these trivial aids that we demand that everybody use. That's absolutely inconsistent.
I'm curious to see if the youth of today have considered bird watching.
Exactly.
Yeah, I think the problem with trying to get accurate dependence numbers with vaping is the products just vary so much, and they're, even though I know in the U.S. it's slowed down somewhat as far as innovation goes, but they're constantly evolving. So, and the more effective products for adults are usually the more dependence forming products for anyone. So it's a tough one to discuss.
Well, and they're probably the ones that are most successful in getting smokers to switch. So,
yeah, exactly.
So it's not an all or none game. It's I definitely want smokers to be attracted to these products and be satisfied by them. That is a must.
I guess sort of in that vein, when you were talking about this sort of trivial trivial tips and how to stay away from smoking, and one of the themes that I think maybe we've all experienced here is this notion that we should just be satisfied with what they give us. I mean, in your experience, or in just life experience, or professionally, I mean, where does that come from? And do people realize the words that are coming out of their mouth when they say these things?
It's hard for me to judge whether they believe what they're saying or whether they are so committed to this nicotine abstinence platform that they just don't have the ability to change. I honestly, it's hard. I'm asked that question a lot about the motivations or, the psychology of the other side. I just find it frustrating because I can't figure them out.
Yeah, I certainly don't mean to heap any stress on you there, but it's just one of those things that keeps coming back up, and it's incredibly alienating and dismissive of what we all experience. Whether we're talking about tobacco or perhaps other. I know I'm going to use the wrong word here, but problematic substance use. So yeah. There's no question there, but
I guess this is probably a question you can't answer, similar to the last one, but going back to year over year, surveys and the questions that they do ask, and then the questions that they choose to omit. You know, as far as the CDC goes, they're very experienced with these surveys. They have to know that when they change things or they omit questions and then they bring them back, that's problematic. Like they, you know, the CDC is filled with incredibly intelligent people. They must know that this is problematic, and so. Do you think in any way that this is to fit certain narratives, whether, you know, if we only ask this question this one year, we can talk about this seemingly big percentage of youths who are doing X, Y, and Z, but we don't have data to fall back on. So we can promote it as this big number and, you know, raise awareness or you know, essentially panic without also being able to explain, oh, hey, by the way, that number is actually down, or whatever the trend may be. Do you think in any way that's to further a narrative or an agenda as opposed to just, oh, we forgot to ask that question this year?
No, there's no way they forget. But, you know, I'll give you another example of how these things have evolved. So when they first started asking about e-cigarettes, this was back in, I don't know, was it 2012 or so? They're on my blogs. I've got all the charts. But when they first started asking about them, they were only mentioned as part of a question that asked about miscellaneous products. Okay? They were a real minor part of that survey. And then around 2014, and don't hold me to these dates, but around 2014, and this was actually part of the spike, they moved e-cigarettes to its own set of questions. And I think it was like the first set of questions was cigarettes, then cigars, maybe e-cigarettes after that, smokeless, whatever. Then, more recently, e-cigarettes have been the first set of questions after they fill out what age and school and, you know, the demographic stuff. It's all about e-cigarettes. And the questions for e-cigarettes have blown up to a very large number. Sometimes they ask questions about e-cigarettes that they don't ask about other products. So it's almost as if a student can't answer the questions, it's like, hey, what am I missing here? You know, it's that kind of, you know, this is the kind of emphasis that you don't even see unless you see the survey questionnaires that are available on the CDC website. If you see those questionnaires and track them over years, you start to see this thing. So it's not just about omission or inclusion of a question. It's all kinds of subtle things that happen over the lifetime of these surveys that may be influencing the results. That's why we need other instruments like the population assessment of tobacco and health, PATH survey from the FDA. It has youth data. The knowledge panel has youth data. There's another survey called the National Survey on Drug Use and Health. Why they've not included vaping yet, I have no idea, but they haven't. We need other surveys in order to make sure that the NYTS is within bounds. And I have blogged about comparison of NYTS with these other surveys in a couple items. So yeah, there's a lot of nuances here that are never discussed because unlike you guys, they're just not asking the questions.
Yeah, I am curious more and more about the way these surveys are done. And and the way that they're put out there, and the questions and all of that. So I appreciate
I'm not like certain. It could be like basically two things in my mind: either the nefarious reasons, or there's just so many cooks in the kitchen. They have different teams working on this every year. And I mean, we saw how much they bungled their messaging with COVID and went back and forth on things like masks and all kinds of crap. So I don't know. It's either, I mean, there's definitely very smart people at the CDC, but maybe their organization is just rotten, and there's no good leadership, or they do have, have nefarious reasons, and they want to, basically ask questions that are going to give them headlines to feed to media.
Yeah, I'm curious if it's that, or if it's this kind of haphazardly trying to update and get more details, following trends and whatnot. I just think maybe for the CDC, it would be really helpful to ask experienced users questions, or see if we can, assist in any way clarifying questions that would make it easier for youth to understand, and try to help cut out some of that confusion amongst products and different terms and things like that, because it is the CDC, and they always, feel a little unhip to what's going on. So,
well, and I'm curious to know, sorry to interrupt you, Logan. There's another survey that CDC does, which is actually my favorite. And Dr. Brad, I don't know if you have an opinion on it, but it's the Youth Risk Behavior Surveillance Survey. Now, that one's only done every other year, which is a huge bummer because, we have to wait. But I actually have found, looking through, their results, that their questions are way more consistent. The way that they report data is much more consistent. National Youth Tobacco Survey, at least in the MMWRs that I can see, I know you have access to the raw data, they didn't even start reporting frequency of use, right? So the number of days that current, vapors are using until the last few years. But the, YRBS has always done that in and it covers multiple categories. It's not just tobacco. It covers, illicit drug use, alcohol, sexual behaviors, all kinds of things. I actually love that survey. And it just seems so odd to me that the CDC can put out, on the one hand, one seems to me really well done survey, and then on the other hand, the one specifically for tobacco use has so many, irregularities and strange things, and seems really skewed.
I totally agree with you. I think YRBS is a great instrument. And, the other positive about asking about a whole bunch of behaviors is that kids are maybe a little more likely to be more honest when the behavior is embedded in a whole big set of things, as opposed to being focused only on, one tobacco. And so I think, for example, in the National Survey on Drug Use and Health, they always have much higher rates of smoking than the National Health Interview Survey. And this is for adults. And I did an analysis and published a paper in I think it was Nicotine Tobacco Research, about the comparison of the two surveys. And what we came up with was that the National Health Interview Survey was a health survey, and smoking is one of those bad things. Whereas the National Survey on Drug Use and Health had a whole bunch of other behaviors that were drug related, and smoking was one of the least, at least the least offensive of the behaviors. And it may have accounted for why people may have been more honest, and there may have been more smoking reported there than had been reported in the NHIS. So there's all kinds of nuances and all kinds of ways of looking at this. And that's what our federal researchers ought to be doing. They ought to be doing this kind of work that help us really, truly understand these issues.
I just have one last question before we kind of make our way out of here. Typically we have these shows on for about an hour. I mean, if other people have more questions or if you have a lot more to add, we'd be happy to keep going. But what is your, I guess, your interpretation of the CDC saying that not only, this survey, this data is both accurate, but also shouldn't be compared? Because that for a lot of people that feels like, well, if it's accurate, why can't we compare it? And I guess my take was that, they're confident in their results being, honest and accurate, but we shouldn't compare it because of, the pandemic, the predicament, social interactions, and things like that. Is that fair, or
well,
do you have?
I think you described the dilemma really well. They say don't compare it to other years, but if I'm not mistaken, that MMWR report had other years in it, or at least some of their reports do. So on one hand, they're saying don't compare it. On the other hand, everybody's comparing it. And that's why I came out with that home versus school blog post to try to clarify. That was the reason they said don't compare it. And so I wanted to at least put that into perspective, that even the school kids, which should be comparable to earlier years, had lower rates. So, I think we're getting mixed messages from federal authorities, and it's just part of the narrative, and I don't think it's fair.
Yeah, it just feels like in one hand they're telling us, this is accurate. We've done our duty here. Our data is accurate, but in the other hand, they're like, but don't compare it. But don't use it. It's accurate, but don't use it.
And also, but we're still going to tout that, X number of million of kids are using any tobacco product, right? So it's okay for us to compare it to prior years when we're talking about, total tobacco products used. But you should definitely not compare. It is, in my opinion, it's very hypocritical.
Yep, I agree.
Well, I did, as Logan mentioned, we are we're at the bottom of the next hour. And we should be wrapping up here soon. But I did, I would love to end on a high note. The malfeasance at the CDC is certainly sort of doom and gloom here. But for the final bit here, at the top of the space, I mentioned the switch to quit Owensboro. And I figure this is probably a good thing to end on, because, as we're moving forward and as more people are realizing the harm reduction potential of smoke-free nicotine products, we're seeing interest from people who cater to certain communities, people who use drugs, people with mental health and behavioral disorders, a lot of underserved people. And I was sort of wondering, with Switch to Quit Owensboro, what were the outcomes? And is this a good model that could be adopted by harm reduction centers, clean needle exchanges, people who are serving people in these underserved communities who smoke at disproportionately higher rates?
Well, that's a great question. And, for the entire time I've been in the tobacco world, it's now 28 years. I've been afflicted with this disease where I'm 5 to 10 years too early with things, and where I'm doing things that are in a total vacuum with nobody else listening. And the Owensboro project, Switch and Quit Owensboro, that we conducted in 2011 was another one of those projects that just was too early. We decide, along with a number of my colleagues here, I decided to commit a large amount of money to a community intervention project where we would give the community the information they needed to make the switch, either to smokeless or to vaping at the time, which, was early in vaping, but it was still available. And we tried to, we had a whole advertising campaign that was professionally done. We had lots of ads. We tried to reach to the community. I traveled there many times. I tried to speak to civic groups and others. We even tried to get the hospital where U of L had a medical connection. We tried to get the hospital to come on board and participate in this, which would have been a big, big plus. Unfortunately, we got backstabbed. The doctors there turned around and wouldn't do it. The local county health department just was against this, and I met with them and tried to convince them. And what we were trying to do, we knew we didn't have the resources to do prevalence testing, to test for smoking prevalence before and after our intervention. And we knew that it wouldn't be sensitive enough. So what I tried to do was measure some form of community tobacco consumption. And I can't give you the details right now, but I did have a decent measure of that. And we had a control city in Kentucky that we were going to try to compare it to. And to be honest with you, the program didn't resonate enough with smokers in Owensboro that we were able to see any impact. I think that our overall program was solid. It was creative, and that was due to the ad agency. It was really cool in many respects, and I'd be delighted to share it. I have no problem sharing some of the components of it. But it was just not the right time and the timing, especially given the pushback that we had. So, I wish we'd have been more successful, and I'd love for it to be tried somewhere else. But it is expensive, and it's a challenge.
Yeah, for sure. And speaking of which, you are obviously on Twitter. I don't want to send people to your direct messages, but if folks do want to get in touch with you, can they get in touch with you through the blog spot, or what's a good way to reach out?
Yeah, look, I'm on social media, but to be very honest, I'm not real active. The best way to contact me is brad.rodu@louisville.edu. That's my email address. It's out there. You can find it on my blog, may even be on my Twitter account. That's the best way to contact me. And once you do, I can give you my phone number and other contact info and be happy to answer any questions. And I hope, despite the problems we had getting my microphone on, I hope to come back. It's been a great conversation. I know you mentioned smokeless at the beginning, and we didn't even get a chance to talk about that. And I'd love to come back and talk a lot about smokeless too, because that history goes way back to 1990s and 1994 with my first publications. And do I have some stories to tell you about that?
Yeah, I was about to say, I think I will definitely have you back on to talk about smokeless, and perhaps we need to put together a panel of folks who have seen the business end of science blacklist, if you will, or people who have been threatened. Your careers have been threatened over simple scientific curiosity about tobacco products. And so that may be another another talk we could bring you back for.
I got a story about that for you as well.
For sure. Well, we will wrap it up this time, I promise. Thank you very much for joining us, Dr. Rodu. It's been an absolute pleasure and a privilege to have you on. As always, folks who maybe didn't hear this or hear the whole thing, we will have this posted up on our website. I think it takes a few days to get everything up there. So you can find that at CASAA.org. If you search for the podcast, Danielle, where do people find this?
So we upload them directly to our SoundCloud. Logan does. I should correct myself. Logan upload. So they're on our SoundCloud. And then also we do record these spaces on Twitter. So Twitter keeps them on our profiles for replays for about 30 days, I believe. I think they may be working on doing that for longer. But at this point, it's 30 days. So for the next month, you can re-listen to this, or if you missed, the beginning of it, listen to it on Twitter, as well as our SoundCloud.
Fantastic. There's like 10 minutes of me trying to fumble through an introduction and work out technical difficulties, but the rest of this is pure gold. So thank you to our board members, Logan, Matt, Danielle, and once again, Brad Rodu. Thank you, everybody, for tuning in and listening. We tentatively are back in 2 weeks on Twitter. We've got our podcast this weekend on Saturday. That is 4:30 Eastern. 1:30 Pacific, and as Logan is prone to say, everybody else in the middle, you got to do your own math here. I know that Matt is in Mountain Time, and that's just whatever. We're going to do away with daylight savings time soon. Anyway, so with that, I'm sure I'm missing some of the other things. I've said all the thank yous, and I think we'll probably end it there.